On this, the 3-year anniversary of the first legal marijuana sale in Arkansas, now a discussion of what might be the next set of drugs to cross over from illegal to medical use.
Since the 1960s, people have used psychedelic drugs like magic mushrooms and ecstasy for mind-altering experiences. THV11's Rolly Hoyt shows us how they may soon be used to help troubled minds get better.
Inside the oldest building in Washington County are some very new age ideas.
I mean, it's a paradigm shift.
The research and evidence is astounding. No question about that.
The old Sarah Ridge House in Fayetteville houses practicing mental health professionals. 2 of them are poised to treat patients using drugs that today are illegal. We're talking psychedelic drugs.
The Multidisciplinary Association for Psychedelic Studies.
And Angie Leake is set to be a founding practitioner in Arkansas. She's been a family counselor her whole life, helping patients work through depression and anxiety brought on by trauma or mental imbalances. Her career in psychology has tracked alongside the growing use of medicine in psychiatry. And at this point, she's convinced the drugs we use to treat mental illness are lacking.
I think there's huge demand. You know, what we have currently doesn't always really work that well.
That's not a fringe opinion. It's a fact that sent the world's finest research institutions, prominently Johns Hopkins, down a path lined with magic mushrooms and party drugs. And their findings have been eye-opening, if not mind-blowing.
When you see a person overcoming their fear of dying from cancer and a year later, they're still alive, they're not depressed again, they're not anxious again, that's a real home run.
Bill Sims hangs his shingle just up the stairs from Leake. He's pointing to study results that said 2 doses of the substance in magic mushrooms relieved depression in 70% of test subjects, and a big percentage of those patients avoided a reoccurrence up to a year later.
Basically, the ability to reduce the symptomology considerably, 70–80% eraser of the symptomology.
Sometimes rapid change and sometimes very long-lasting change. So that's not like anything else we really have right now.
There are 4 drugs that are in various stages of going from illegal to legal, being studied by researchers and the FDA. Ketamine has gone from disco drug to treatment for PTSD already. There are practices offering it in Little Rock right now. And you've got medical marijuana. It's obviously legal, though actual evidence of its effectiveness is limited because federal law had prohibited studying it for decades. Then there's MDMA, or ecstasy, and psilocybin, the stuff in shrooms. The latter is a true psychedelic, but both send the mind and body to a heightened state of awareness. And that, along with therapy, opens the door to treating issues buried in a person's psyche.
So if people are able to access these really difficult and painful memories, and they're able to do that in a very supportive environment, when that memory file gets closed and tucked away again, it's now essentially re-encoded with this more positive experience.
Those experiences are why Leake's phone rings off the hook with each new bit of data. She ends up warning a lot of people that, hey, this is still illegal. But Sims thinks it won't be too much longer.
We're talking about maybe 18 months for federal approval of use of this.
Sims says MDMA probably arrives first, followed by psilocybin. But that's moving at the speed of the FDA. Other states, notably Oregon and some close to Arkansas, have passed local laws that open the door either through therapy or just legal recreational use. That path drags these drugs into the decriminalization debate. These 2 counselors have opinions on that, but for now, they're patiently waiting for either road to open, and to them, it can't come soon enough.
This isn't a state line issue or a partisan issue. It's an issue of people suffering and needing relief.
But the good it will do for rescuing people who live in hell is really too powerful to ignore.
In Fayetteville, Rolly Hoyt, THV 11 News.
Now, we reached out to State Drug Director Kirk Lane, and he says he's far more cautious about legalizing these drugs.
He doesn't see the FDA moving as quickly as the counselors expect, and he has questions about the safety of these drugs. Both the counselors we spoke with say professional guidance and observation will be absolutely necessary for these drugs to be effective and safe.